Good to see everyone. I hope you're having a wonderful Friday. And before we get started, let's just take a moment and just get mentally focused and present. I know I need this because Fridays are my craziest day at work. So just uncross your feet and just close your eyes and take a deep breath in and let it out. And just let all of the to-do list, the work, let it go. Feel your butt in the chair. Feel your feet on the floor. Take another deep breath in and let all of it go. Okay, that helps me. So I hope that helped you. All right, so let's dig into sleep. So I'm excited about this one because sleep is really, really important. So let's first talk about why sleep. So sleep is a predictor of many diseases in terms of the health outcomes. The CDC has actually determined that sleep disorders is a public health epidemic. When you're not getting that good sleep, that sleep disorder will actually increase your risk for neurodegenerative diseases, so dementia, Alzheimer's disease, Parkinson's, depression, ADHD. And we also know that having disturbed sleep is not only causative for these degenerative diseases, but also the degenerative diseases are going to cause disrupted sleep. So you get this whole snowball effect going on with the brain health. But it's not just the brain, it's also about the heart. Sleep disorders will increase the risk for cardiovascular disease, so hypertension, diabetes, obesity, stroke, heart attacks. It will increase the risk for just having an accident, like tripping, car accident, you name it. But then, of course, it's going to affect our behaviors, our physical activity, the addictions for smoking, alcohol consumption. Now, the special little note on alcohol is, we know, a lot of people say, well, alcohol helps me sleep, but actually, alcohol disrupts the sleep quality that you get. So you don't actually get as restorative deep sleep with alcohol consumption. So sleep is really, really important. This is how our body is going to reset. It's how our brain is going to reset, how our tissues are going to heal. Now, one thing that we tend to see is that as you age, you feel like you need less sleep. Actually, you still need sleep. It's just that as you age, your body is incapable of creating enough time in the sleep phases. And so we get to see there's less time spent in the deep stage, there's less time spent in the REM stage. You get this changing of the circadian cycle, this changing in the sleep architecture. So you actually still need the sleep. Your body just kind of becomes incapable of sometimes getting enough sleep. And so with that idea, we can almost think of aging can be considered in itself to be a sleep disorder because aging can trigger lack of sleep. So why do we need sleep? Why am I saying this is so important? So what happens is that sleep time, when your body is resting, that's when your body releases what we call the growth hormone. The growth hormone is the hormone that stimulates repair and regeneration in the body. So this is going to repair your immune system, your muscles, every cell, your tissues, your tendons, your bones. It's going to increase blood supply to the muscles. And this is only released in the deep phases of sleep. So you can imagine if you're not getting enough quality sleep, if you're not getting into enough of the deep phase of your sleep, you are literally breaking apart your body because you're never hitting the regenerative rebuilding phase of your circadian cycle throughout the day, which happens when you sleep. Now, there is some really exciting correlation again with the brain, and those of you who have known that we family has been battling some Alzheimer's disease and dementia personally, I get really excited about the brain and what can we do to improve the brain. So in 2012, the lymphocytes were discovered in the brain. So the lymphocytes for those who weren't on a prior talk about the brain, this is the immune system of the brain. So this is the lymphocytes is your lymphatic system of the brain. It's where you're going to be draining out your toxins, clearing away your amyloid and your tau proteins, so your amyloid plaques. And the lymphocytes are only active during that deep sleep cycle. And so if you're skipping enough sleep, if you're skipping your deep quality sleep, you're not getting enough time in your sleep phases, then your lymphocytes aren't given enough time to actually start to clear out and detoxify your brain. And then you'll start to build up your amyloid plaques, your tau proteins. Now, the lymphocytes also clear out anesthesia. So this will correlate with if you have to go into general surgery and you feel really brain fog afterwards and you're having trouble mentally clearing the anesthesia. It's the lymphocytes in your brains that are doing that. So this is where there's that big correlation between the decreased sleep and having a significant, and I mean significant, risk for increasing Alzheimer's disease, dementia, aging brains. Because now your brain is more toxic, you are not clearing out your tau proteins and amyloid plaques, and then you're also just, remember the growth hormone piece, then you're also not doing your cellular regeneration. So you're not actually repairing your body. So let's dig into the whole sleep cycle and what it means. So for those of you who have heard about REM sleep and deep sleep, I hope this kind of gives some more information. If you have a sleep tracker like a Fitbit, or any of those, they'll give you the phases. And so this will help you kind of understand what you want to see in those phases. So the brain has cycles. So it goes through about 90-minute cycles repeatedly throughout the night. And so each cycle is going to have an awake phase. Then we're going to have the wake phase is more brain activity. Then you have stages 1, 2 through 4, which is considered our non-REM phase. So this is the deep stage is going to be stage 3 and 4. And that's also known as slow wave activity. So what happens is, so you have your awake phase where your brain is awake. Stage 1, you kind of start to calm down. Stage 2, you calm down more. And then 3 and 4, you're deep. And then you'll come into the REM phase. So let's get more into each phase. So the awake phase optimally is less than 20 minutes in that 90-minute cycle. And then you hit the non-REM stage 1. So that's where you're getting a slowing down of your heartbeat, slowing down your respiration, slowing down your eye movements. Your muscles will start to relax and your brain waves start to slow down. And then you enter stage 2, where you get more relaxation. So your core temperature is going to start to drop. Your eye movements stop. Your brain waves slow down more, and your body continues to slow down, relax. Then you hit your deep stage. So the deep stage is going to be stage 3 and 4. So optimally, we want to hit more deep stages in the first 4 to 5 hours of the sleep cycle. And if you're tracking on your Fitbit, you might see, you're like, wow, you just go into deep phase really fast, because we want to really hit the deep earlier in the night. And during this time, your heartbeat and your breathing are at their slowest because your muscles are the most relaxed. And this is the slowest phase of your brainwave activity, hence the name slow wave sleep. And if you're in this phase, if you're truly in it, is it extremely difficult to wake up even with a loud noise. Your brain does not want to wake up in this phase. And you could have someone jackhammering in the room next door, and if you're in this phase, you shouldn't be waking up to that. This is where you're going to form your short-term and long-term memory formation. So this is really key for your memory and brain health, is you have to get to the deep slow wave phase. This is also where your pituitary gland is going to secrete some essential hormones that are going to help to balance the whole endocrine axis. And because you're in such a deep sleep, this is the hardest phase to wake up from. So if you are woken up in the deep phase, you can have 30 to 60 minutes and upward of mental impairment, brain fog. you're woken up, because you're not supposed to be woken up out of this phase. So you feel really groggy if you wake up in the morning. So for some patients, so if you feel like, well, I have some clients who try and restrict their sleep to 5 hours, because if they get more than that, then they feel really groggy. So what's happening is that they've basically readjusted their sleep cycle. So then their body, if they get more than 5 hours, the body is actually hitting the deep sleep phases later on. And that's why they feel really groggy in the morning, because they've restructured the architecture of the whole sleep cycle. And so it just takes time to repattern the sleep cycle. So you're through the deep sleep phase, you've formed your short-term and long-term memory, and now you're going to enter your REM phase. This is stage 5. So the REM phase, ideally and optimally, we want this to be more dominant in the final half of your sleep cycle. This is where your dreaming is going to happen. So your brain activity is going to be in a more wakeful state, which is what allows you to dream. This is where you see the really rapid eye movement. And if you've ever watched someone in a REM state, it's kind of crazy. You see their eyeballs just going back and forth. You're going to have this increased heart rate, increased breathing, but your limbs are more in a paralyzed state. So that's how it's a big way different from the awake phase, because the awake, your limbs aren't paralyzed. But in the REM state, your body is awake, but your limbs are paralyzed, which allows that dreaming to happen. Now, as a side note, many antidepressants on the market will actually suppress the REM sleep, just a nature of the side effect. So ideally, when you wake up in the morning, you actually want to be waking up from your REM phase. That is what makes you feel awake and energized when you wake up out of bed. It's optimal for getting your brain function up and going, reducing that brain fog. And so ideally, you want to be waking up out of that REM. So for those of you who have the sleep trackers, you can be looking at, okay, hey, so am I hitting majority of the deep phase in the first half of the cycle and REM in the second half of the cycle? And are you waking up out of that REM phase? Now, let's talk about timing and optimal sleep timing. So less than 7 hours is considered short, insufficient sleep when it comes down to brain health. Now, in terms of efficiency, we want it to only take 20 minutes to fall asleep. More than 20 minutes, that's not an efficient sleep. Timing, so this is actually really key, is we want the midpoint of sleep to fall between midnight and 3 a.m. Otherwise, you lose the deep sleep phases, you lose quality in the deep sleep phases, you start to shift your architecture of your sleep cycle. And so this is where getting to bedtime before 10 p.m. is really key, because if you don't, then you'll start to push out that midpoint of the sleep cycle, and you could potentially start to be losing those deep phases. In terms of percentages, because a lot of the Fitbits or trackers can give you this data, the deep sleep should be about 15 to 25% of the total time. Ideally, in my opinion, it wants to be more than 25%. We want to hit that higher side of it. So that's more around 1.5 hours total of your full sleep cycle. And the REM is about, again, 20 to 25% of the total sleep time. So now let's talk about, and so now you understand the architecture of the sleep cycle. So you're going through, so each 90-minute cycle, to recap, is going to have the awake stage, the deep, the non-REM and the deep, and then the REM. And then you're going to keep going through that phase throughout the night, multiple cycles. So how do we maximize the quality of these phases that we're hitting and when we're hitting these phases? So let's talk about alcohol, stimulants. So alcohol will reduce the quality and the efficiency of the sleep. So you might feel like you fall asleep better. That's probably more because of the GABA effect of alcohol, and GABA calms down the nervous system, but it does not improve the quality of sleep. Caffeine just makes your brain awake, so that's a simple correlation there. Blue light, I love my blue light glasses, and I make my kids wear blue light glasses whenever they're on their tablets or having screen time. Blue light is very well researched to impair your deep sleep phase of your cycle. Even having blue light exposure during the day can impair your sleep cycles later on at night. Hydrotherapy. This is a cheap and fun trick, and there's actually research on it, which is exciting. It actually, in 2019, there's a meta-analysis on it. So you can start this tonight if you're not already doing it. So basically, just all you have to do is just take a warm shower or a warm bath within a 1 to 2 hour period before you go to bed, and it can be as little as 10 minutes, and it's shown to improve sleep quality, efficiency, and the deep phases of your sleep. So that's an easy one, because if you think about it, that is also, it's starting to relax your body physically, it's starting to relax your brain, and so you have less of a wall up against you to get to sleep. Exercise. It's always kind of been a big question, when is the best time to exercise? So there was another meta-analysis research study done on this one, and the result is that it actually really doesn't matter that much, except for 1 hour before bed. As long as you're not exercising 1 hour before bed, I was actually really surprised by this research, that it didn't disrupt the deep sleep phase of the cycle. And it actually, and any exercise at all basically still increased the REM and increased the quality of the slow wave sleep, so increased the quality of the deep sleep. If you exercise within that hour, then your sleep will get disrupted. So most of the time that's not an issue unless we have our athletes that are going straight from high intensity exercise to bed. Noise. Let's talk about noise. So you've probably mostly heard of white noise. Pink noise is the one that is now the best. So pink noise is all the audible frequencies to the human ears. So this is what you're gonna hear throughout the day. This is your normal range of sounds that you hear. So the pink noise is actually going to be best during the first 90 minutes of sleep when you're entering that deep sleep phase. So it's going to help improve the quality of that deep sleep. There are a ton of different smartphone apps out there for noises. And if you download one, I would just say turn off the white noise, turn off the brown noise, and then just take the pink noise all the way up to 100%. Sorry, my office is pinging me. Just had to make sure that everything is okay. We're good. Let me bring my screen back. All right. Acupuncture. There are quite a few acupuncture points. I am not an acupuncturist, so I cannot speak to the points, although I do know there's one they use behind the ear. Acupuncture, anytime you use the needle, I know that's very well researched that it actually stimulates the parasympathetic nervous system response, so the relaxation part of the nervous system response, but there are actually indeed specific acupuncture points for sleep. Melatonin, let's talk about this one. So I was actually surprised to learn that melatonin alone actually does not improve the deep sleep or that slow wave activity of your brain. What it does do is it shortens the time it takes to fall asleep, and it increases the amount of overall time that you are sleeping. So for our athletes who are exercising very hard right before bed, this is when melatonin can be really useful, because there's actually a study on this where when taking that high intensity vigorous athlete exercise an hour before bed with taking melatonin, then they were actually able to, the melatonin was able to counterbalance the effect of that exercise within that hour before bed, and they were actually able to increase the REM efficiency. But with that said, I still find melatonin very useful. So because a lot of patients have a hard time just calming down the chatter of the brain, so it can help calm down your brain, help you enter those different phases of sleep. It's not necessarily going to be a predictor of improving the deep sleep phase, but it will help to calm down your body and relax it so you can get into the sleep. Let's talk about diet. What type of diet is going to help your sleep? So there was a really good 2016 research study on this one. that showed that the deep sleep phases, slow wave sleep period, decreased in the quality of it with a high carb and paired with a low fat diet, versus the low carb high fat diet showed to have an improvement in the quality of the deep sleep phase of the cycle. Now, with that said, so I think if you just cut carbs out completely, you're going to have issues, and you can impair your deep sleep phase. It's all about balancing your macros, and everyone's going to have a different macro balancing that's unique for their body. But with that, you can take that information, then you can adjust that final meal in the day to help promote that better sleep. And so generally you want to not be eating 3 hours before bedtime, and you want it to have more of the higher fat ratio, because that's going to balance out your blood sugar throughout the night. Because if your blood sugar drops, then your body's going to wake up and pull you out of your sleep and you'll get a disrupted sleep cycle. But then you still need some of those carbs to help maintain your blood sugar. So it's a balance, like everything. It's a balance between the protein, the fat, the carbs. In terms of intermittent fasting and fasting diets, the research is still pending on this because it's generally a new thing. The issue that I've tended to see is that patients have the fasting window off, and most patients are fasting from they're not eating until noon and 6, and then the dinner is way too close to bedtime, and most of their calories are at night, and the breakfast is really light again, and that just screws the entire circadian cycle. The fasting window should be you still eat within a 90 minutes of waking, or 60 minutes of waking, not 90, 60, and then you just stop eating early. That maintains your adrenal circadian cycle, your sleep circadian cycle. Couple medications I want to talk about. Trazodone is actually really special. So this is a medication used for sleep, and what's been shown is that it actually increases the deep sleep phase, the slow wave activity, and has actually been shown to delay cognitive decline and slow the rate of decline for dementia and Alzheimer's disease patients. And it does that because it improves that deep phase of sleep. Ketamine therapy, it's a NMDA receptor antagonist used for depression, eating disorders, a lot of mood disorders. It basically increases, it improves the sleep because it actually increases the deep phase, the shortwave activity of sleep. And it also increases the brain-derived BDNF factor in the brain, which is what repairs your brain tissue at night. Altitude. The brain has a lower capability to get into your deep phase with less oxygen. So the higher you live, the more hours you need. I can tell you I clearly do not get enough sleep based on that, and I'm living at 9,000 feet of altitude. Sleep apnea. So sleep apnea does not actually affect your ability to enter the deep sleep, but it won't allow you to stay in deep sleep because your body will wake up when you get too low of oxygen. So it will just keep waking you up out of those deep sleep cycles. So overview, let's recap. I know that was a lot of data there. So sleep quality, efficiency, and timing are all very crucial for preventing a lot of diseases, not just the brain, the heart, how everything heals in your body all the way down to each cell, which is huge. So sleep is literally your elixir for anti-aging, right? Aging is the breakdown of tissue, the breakdown of cells. Sleep is literally trying to regenerate your cells. You can't get anything more anti-aging than sleep. And if there's one item, kind of in my opinion, that most important to focus on from a health perspective, it's optimizing sleep. And I've seen time and time again, you can't lose weight if you're not getting good sleep. You can't get inflammation out of the body if you're not getting good sleep. You can't reset the thyroid or the adrenals or your hormones. Sleep is one of those foundational cornerstones for the body physiologically. Otherwise, your body is stuck in this physiological stress response, and it's stressed out all the time. And so we have to sleep to recover our body. So that was my talk. So start shooting your questions out through the chat. I have one question. I'll already start talking about that. But if you have any specific questions, I would love to answer them. So first question is, can you please spell the medications? So the two that I talked about, trazodone, Trazadone, and that is the one that has been shown to slow down the rate of decline for all dementia and Alzheimer's disease patients, because it gets you into the deeper phases of sleep. And then ketamine, you have to be at a very specific ketamine clinic to get this one, because it is a pretty big drug, but it's Ketamine. It's most of the time ketamine is going to be given IV. So that is you usually only get kind of rounds of treatment with that one. The trazodone, more and more patients I'm seeing are having that one. They're coming in being on trazodone. I'm excited for trazodone, especially with all the research of dementia and Alzheimer's. Take a sip of water while more questions come through. And for those with kids, think about pediatric brain health too. And with like ADHD and ability to focus in school, if kids can't get good quality sleep, then they're not going to be able to focus in school. They're not going to be able to sit down and have the energy to learn, or to be able to focus. And anything that you can do to kind of improve the sleep quality. And I think it's important to train kids how to have a healthy hygiene with bedtime, with restricting technology out an hour before bed. You can even give some magnesium to help calm the kid down, working with meditation, the brain.fm, the auditory waves, the pink noise. There's so many tools and tricks. And I find it's good to have a bucket of tricks, especially with the kids. And just starting to teach them now how to have a healthy bedtime routine is just sets up their body to be physiologically so much more advanced, better. Like they're just going to be able to process life better. One question is, spell the second drug again. That one is ketamine, Ketamine. And you usually have to go to a specific ketamine clinic for that. Another question is, did you mention needing to go to bed before 10 p.m.? Ideally, yes, because you want the middle of your sleep cycle to be between midnight and 3 a.m. And to be honest, in my opinion, I think it probably needs to be more closer towards midnight than 3 a.m. And otherwise, if you're not hitting your midpoint in your sleep cycle between those hours, you start changing the architecture of your sleep cycles, and you'll start to potentially reduce the quality and the timing that you're spending in that deep wave. And it's that deep wave that is so crucial for healing your brain and everything in the body. When your brain is the slowest, your body is, every muscle is as relaxed, your heart rate's the slowest possible that it is. Good questions. Keep my screen up so I can see any other questions that come on through. In terms of trackers, there's one that I was looking, I was excited about this. I might get it for myself. It's called the Oura Ring, OURARING.com. So it's just a ring that you wear, and then it doesn't emit all of the EMFs that we're concerned with, like the Fitbit, because basically we know that in itself can be disrupting your own sleep cycle. And so that is one that has the least amount of emission, and you can wear it throughout the day. It's easy, because I know a lot of patients, me included, and I just don't like to wear a feeling like wearing my watch when I go to bed. This is just a ring that you have to go to wear. So it's much less intrusive. It's water resistant. I have no connection with them. I was just really excited to see that there is something that is a lot healthier, and actually from the research for their technology, it looks like you get much better and more accurate data than a Fitbit, than one of the devices that you put under your pillow or on your mattress to try and capture your movement. Is actually calibrating your sleep cycle based on kind of oxygenation, capillary flow. So it's a different sleep technology out there, and I'm excited to. I just heard about that one from a colleague, and the more I looked into it, it looks really good. And what I'll do is I'll put the link. Let's see. I'll put the link in the chat here so you can check it out if you want. Let me talk a little bit deeper in the nutritional piece. So this is a bigger topic, probably could be its own lecture in itself. But basically, if your blood sugar is not stable, and if it's dropping, your brain's going to wake up and it's going to try and wake you up and say, hey, you need to go hunt and forage for food. It's a very biological mechanism in our body that hasn't evolved since the caveman days. Now, so the better you are at improving your blood sugar balance throughout the day, the better your sleep is going to be. And so this literally goes back to breakfast. Breakfast is when you start is the foundation for your blood sugar control, starting in the beginning of the day. So that goes back to eating within an hour, waking, getting balancing your protein, your fat, your carbs. And then you also want to make sure you do the most of your food eating, your calorie consumption in the first half of the day, and make dinner really light. You can still be sitting down with your eating dinner with your family, but you don't want dinner to be your largest meal. That will end up disrupting the circadian cycle of your sleep, of your metabolic system. There's more and more research coming out about this. And going back to the whole intermittent fasting thing, that's usually why I have such a big issue with intermittent fasting not done at the right timing during the day. You still get good physiological benefits for intermittent fasting at any point in the day, but my concern is how it disrupts and changes the architecture of the circadian cycle, because your metabolic system has a circadian cycle too. So usually if you're craving more sugars, carbs in the afternoon, evening, probably what happened is your blood sugar wasn't balanced well enough in the first half of the day. So you've been having these blood sugar crashes. And so that's your clinical sign that you need to improve your nutrition, improve your blood sugar balance. Cut out the processed food, the refined carbs, the grains, any food sensitivities that you have, the sugars. It's amazing how much sugar is in food, because it's a great way to sell food. Everyone loves it. It's addictive. So why would you not put it in the food that you want to sell? So a little bit about that. All right, I'll hang out here for a couple more minutes before I have to start prepping for my afternoon of patients. All right, I don't see any more questions that are coming through. So if you guys think of any more questions, feel free to send them over. Otherwise, I hope everyone has a fantastic weekend and get some self-care time. Oh, one more question that came through. Let's see. Question is, using the brain.fm app, does it have to be used before sleep or during the night when you wake up? I've used it both. You can use it when you're reading your book to kind of calm your brain wave activity down. You can use it falling asleep and just set a time limit on it. You can use it at 2 or 3 in the morning when you wake up. I've used it before when my 4-year-old wakes me up and then I'm awake and I can't go back to sleep. And I feel like I don't always get back into the deep sleep, but at least my body is a more restful state than it was if I didn't use the brain.fm. So it's another tool in the sleep toolbox to help with that quality. All right. Well, it was so good to see everyone, and I hope everyone has a wonderful weekend, and we'll be in touch about next week's lecture. All right. Have a great weekend, everyone. Bye.